We believe that the most effective leaders will take stock of how other respected healthcare executives are operating during this time. As the quarterbacks of the healthcare world, primary care is where most patients will begin their journey. A registered pharmacist, board-certified family physician, and certified family investigator, Dr. Hugh Durrance has been a solo practitioner in Charleston, South Carolina since 1998. In 2015, Dr. Durrance and 4 colleagues began Liberty Doctors that, in 5 short years, has grown to over 20 active independent practices in the Low Country and Grandstand areas. Welcome, Dr. Durrance. Thank you for being here.
Thank you for inviting me.
I'm going to start by asking you, what's the single biggest hurdle you expect to face or you're facing already as you work through the COVID pandemic?
Well, of course, that would be getting test kits to be able to test our own patients, and also having enough PPE, which is personal protective equipment, in our own offices.
What is one key thing that you're doing in the current health and economic climate that prepares your practice for the road ahead?
We are following the guidelines from the CDC and the state government to include the Accelerate Committee that the governor has come up with, and we're working with payers as the new recommendations for COVID-19 and for opening our economy comes up.
We're going to get into the payer situation in a little bit, but I do want to ask or have you offer one piece of advice for other similar practices, other primary care groups in the Southeast. What is one piece of advice as they navigate through the COVID-19 pandemic?
Take initiative, adapt, accommodate, and overcome as the new recommendations for COVID-19 come out.
How have you had to rethink your care for in regards to your patient safety?
We are doing virtual visits. We are doing telephone visits. We're doing parking lot visits, kind of a drive-through visit to keep our patients and our team members safe.
We've heard before from other physicians that their groups are doing parking lot visits as well. Will you tell me a little bit more about how that operates?
We do a risk stratification of the patient over the phone before they come in, and we determine how sick they are, and if it's someone that we want to that's acute, that we feel may be pretty ill, we'll try to see them in the parking lot, either in their car or in a temporary structure that we got set up, which is a tent, which is getting more substantial as we go along because of various things, and we try to risk stratify them and understand what exactly is going on. If it's COVID, we have to handle it a little more carefully and get the testing done.
So I'm sure it's a learning curve.
It is.
What type of pieces of advice or what type of things have you learned in your seeing patients in the parking lot?
They appreciate the fact that we have gone to these lengths to keep them safe, and so do our teammates.
We think we're all in marketing, and we think that brand position is extremely important at this time. Give me a little bit about how you feel the importance of having a graceful voice to your patients during this time. What does that mean to you in your practice?
For us, it's letting patients know that we're open and we're available to them in multiple ways and to help keep them safe. And as far as brand goes, Liberty Doctors providers are independent from the local healthcare systems, but we have relationships with all of them, and therefore keeping our patients' choice of healthcare is our top #1 priority.
I noticed from your advertisement that you guys keep on the back cover of Health Links, thank you, that you guys have started to market telehealth and virtual visits. Talk a little bit about that adaptation for your practice and how the patients are responding to telehealth or virtual visits.
Well, we're still doing Health Links, and we think it's a good publication. It's well written, and it's done really well for us from our inception, I might say. And then we have adapted our website and our portals in our EMR to try to reach out to our patients, engage them, let them know we are open, things are safe, and to educate them about COVID-19.
So if I'm a patient that needs to come in, or I want to see Dr. Durrance, but I don't want to come into the office, and I'm not very comfortable coming into the parking lot, your staff or your practice will recommend a telehealth visit.
Absolutely.
What does that look like for me as a patient?
For you as a patient, we have our technical people get on the phone with you. We make sure that you've got the proper iPhone, the proper connection. You are in the comfort of your home. You feel safe. We're in the office, and in some instances, we have to do some monitoring of vital signs, that kind of thing. We have the ability to do that to some degree, and it's just a very good interaction between the provider and the patient. It's one-on-one. You see and hear. It's more of a human touch than just a telephone call.
Sure. I can imagine it being more productive even than a telephone call or a nurse call. Let's move over to the payer reimbursement for telehealth visits. How is that working? Has it been seamless or has it been cumbersome?
Early on, we have a good team in our MSO, and early on we didn't have the ability to do telehealth visits. So within a week, we had our telehealth up and running. We had our contracts done. Our QHD, our MSO, did a very good job with that. It took us a little while to get the contracts enabled. Thankfully, our federal government and our president recognized the need for doing this early on and pushed Medicare to do it. And that helped some of the other payers, I think, figure out that they needed to do it too. And so it took a little while, but and there were some bumps in the road as far as getting it paid for, but we're there. I hope we will be able to keep at certain aspects of it.
So currently the reimbursement it's working?
Yes.
Okay, for telehealth. It's good to know. I would ask the question, what's the most innovative aspect of healthcare delivery you put in place during this pandemic? Something that's maybe even unique to Liberty doctors, something that we can offer to the other providers that will be watching this video?
Well, as I said, when we started doing our drive-through parking lot visits, I mean, we actually set up tents to triage.
I've seen them.
And
Yep.
and as well as we set up tents for our laboratory draws, so customers could drive in, do what needed to be done, and drive out. And they've been very receptive of that. They respect the fact that we are giving them that extra margin of safety.
One of the most important concepts right now during this COVID period is patient and consumer confidence, right? You need patients to be confident that they can still see the doctor if they're feeling ill. How do you work on improving that patient confidence? One of the things that we've done is offer free subscriptions to our publication to the patients of our partners. What are some of the things that Liberty doctors, and how do you reach patients, and how do you build that vulnerable confidence during this time?
We reassure them with every call, every interaction with any of our people that we are keeping their safety upmost in our minds, and that we have, as I have described, all of the avenues to keep them safe, but yet give them every aspect of care that they need, including their preventive care. The problem is that they have been reluctant to come in, and there's a big deficit of preventive care that needs to continue to keep patients with chronic diseases healthy and keep them on the right trajectory to be better.
We feel that touching a patient right now, not physically of course, but interacting with patients is extremely important. What mediums is Liberty Doctors using to reach patients?
We are using our website. As I've said, we're using our portal. We're using some short segment TV. We're using health links, and I hope you'll be tying in with your subscriptions articles that will help us assure the patients that we, as primary care and as physicians in general, our colleagues in offices, that we are doing what we need to do to keep them safe, that they need to come and do their regular health care visits.
And those, you said doing what you need to do. Give me a couple examples. You said following the CDC guidelines. Give me a couple examples of what an in-office visit would be like.
An in-office visit?
Sure.
We would triage the patient on the phone ahead of time, know what the problem is. They come to a door that is locked with a big stop sign. We have someone to greet them up front. We review the COVID symptomatic questions recommended by the CDC guidelines. We make sure those are all negative. We check their temperatures. We put a mask on them if they don't already have one, and I hope everyone now wears a mask, okay? And then we allow them to wait in their car before they do that, and then we call them in. We go through that procedure, and we take them to the room. They're immediately seen by the provider and leave.
I think amongst the community and the medical community here in the Lowcountry, we have a high level of respect for Liberty doctors, and I guess my question would be, knowing that, what's a piece of advice you can offer to healthcare entities and providers who haven't been as successful, as seamless as you guys have through this time? A final word, a final thought.
Don't be afraid to put your toe in the water and get busy. And as I have said, look at the latest guidelines, implement them in your practice, tweak it and adjust it, and depend on the team that works with you, because without your team, you will not be successful. It has to be a single movement from the entire team to reach the goal, so we keep our patient safety.
That's one more point I want to talk on. I think you have the patient confidence, but what about the confidence of the employees, of your doctors, of your nurses, of your PAs, et cetera, or even the folks answering the phone, the techs? How do you work together? How do you work and make that work seamlessly together?
We have multiple meetings, and I'll have to say I'm very grateful. I think I've got one of the best teams in the Lowcountry, and we have multiple meetings. We have met incessantly at least once a week. We have an entire office staff meeting. We bring everybody up to date on the latest CDC guidelines. They have changed a great deal, day by day almost, and we take everybody's input. This is not driven from just what I think, it's everybody's input, and we encourage our people to participate, and we take their recommendations seriously and we implement them, and that way they buy in to what happens in the office every day and they feel safe. We have early on, before March, we put in our barriers that we needed to put in of acrylic. Everybody wears a mask. We worried about we thought about everyone wearing gloves, but we changed that because there are not going to be enough gloves. So everybody does a lot of hand sanitizer, and they do a lot of cleaning all day long every time a patient's seen.
As the leader of Liberty Doctors and your top colleagues within your organization, how do you relate to your entire team at once? How do you motivate your entire team at once? I've found within my organization there was a lot of just people going into funks, people not participating at their highest level as they had before the pandemic. How do you motivate folks that are concerned during this time?
We first of all show caring in our operation, and we say every time we meet, we want to make sure that every individual on our team, that number one, they are safe, that their family is safe, that their family has what they need during this pandemic. We start there. And then we get everybody's input, and they know that they are safe in the office. They know that we're doing our very best with their input and all of us working together to take care of our patients. And we want to give what we've always tried to give, which is the very best primary care in the Low Country.
Has anything changed in terms of the? It seems like collaboration amongst your peers and your colleagues with different providers and from primary care to specialists. It seems like it's more important right now than it's ever been. Can you speak to that?
It is more important. It's got to be. We were already in that tilt with our accountable care organizations to try to have better cooperation and collaboration to make the entire system more efficient. I think that the pandemic has really brought into focus the problems with our system that exist, and I think that we all as healthcare providers and physicians realize those shortcomings, and we realize that we've got to be integrated, and we've got to speak up and be heard so that we have what we need to take care of our patients. You cannot open and have a good economy and not have spikes and not move forward and not have more deaths if we're all not collaborating and working together. Not only primary care and specialists, but also people in the community, businesses.
Well, Dr. Durrance, I appreciate you coming to visit us and speak to our audience. Dr. Hugh Durrance, thank you.
Thank you.